Jess, is it? Hi Jess, I'm Devaney. I'm going to be your GP today.
Hi.
Tell me, what brought you in today?
Well, I'm worried I might have an infection. I have a discharge and I just need to get it sorted out.
Okay, so what do you mean when you say discharge? Is it a vaginal discharge?
Yes.
Okay, just tell me a little bit more about the discharge.
It's really horrible. It's a yellow-green colour, a bit like the stuff that comes out your nose when you've got a cold.
Sure.
And it's thick and uncomfortable.
Okay, and how long have you had this discharge for, Jess?
About 3 days.
And before that, nothing abnormal?
No.
No. Okay, and is this discharge associated with anything else? For example, pain with urination or pain going to the toilet, your bowels?
I've got pain in my lower tummy.
Yep.
And when I urinate, it stings a bit.
Stings a bit, okay. Other than that, are you well within yourself? Do you have any fevers?
I'm well.
No sweats or anything like
No.
that, so it's just the pain and the discharge? Okay, and have you ever had this before?
A few years ago I had something similar and the doctor gave me pills and it got cleared up straight away, yeah.
All right. Okay, and can you think of anything that could have brought this on?
No, not really.
No, and you haven't had any treatment or tried any treatment for it as of yet?
No.
All right, Jess, I'm going to ask you a little bit about your sexual history, only because it could be relevant. It's all confidential, so let's start with, are you in a relationship at the moment?
Yes, I have my partner Ben. I live with him when he's here. He's away at work a lot, so...
Right. And how long have you been with Ben for?
About a year.
Okay. And do you have intercourse with him?
When he's in town, yeah.
Yep. And what type of intercourse do you have? Vaginal, anal, oral?
Mainly vaginal.
Vaginal? Okay. And do you know if Ben has any of these symptoms? Does he have a discharge? Was he complained of anything?
He's away at the moment, but no, he gets back in a few weeks, but I don't think he's got any symptoms.
Okay, so how long has Ben been away for?
2 weeks.
Okay.
He gets back in 2 weeks. I really want to get it sorted before he gets back.
Okay, and have you or Ben ever had a sexually transmitted infection before?
No, I just had a bit of thrush. It's about 2 or 3 years ago.
That's what you were talking about earlier. Okay. And have you had intercourse with anyone else recently?
I had a bit of a slip up last Friday night. I spent the night with a guy from work.
Okay.
After drinks.
Okay, sure. And so this started obviously after that. And did you use protection at all?
No, I've got my tubes tied, so...
Sure. Do you usually use protection with Ben?
No.
No, nothing. Okay, sure. And that's the only other person you've been with in the recent times? No one else? Okay. And you didn't notice anything at the time? It was just the last 3 days that you've had the discharge for?
That's right, yes.
Okay, sure. So we don't need to worry about you being pregnant. So I'll ask you about your other gynecology history. Have you had pap smears?
Yes.
When was your last one?
About 2 years ago.
Okay. All right. And have they been normal, your pap smears?
As far as I know, yes.
Okay. And what about your period? Do you get your period regularly?
Yes.
Okay, when was your last one?
Last period, 2 weeks ago. 2 weeks ago.
Okay. And you haven't had any have you had any abnormal bleeding?
No.
No? Okay. And have you ever been pregnant?
No.
No. Okay. I'm just going to ask about your other general health. How are you generally? Do you have any other major medical problems?
No.
Specifically diabetes, asthma, heart problems?
No.
No? Good. Are you on any medications?
No.
And do you have any allergies?
No.
Okay. And is there anything that could be relevant in your family history, major diseases wise?
No, not that I can think of.
Okay, good. And what do you do for a living, Jess?
I work in a design workshop.
Okay. Full-time, part-time?
Full-time.
Okay, great. And do you smoke?
Yeah, 15 a day about.
Okay. And how long have you been smoking? 15 a day?
About 10 years.
About 10 years? Right. And apart from smoking, do you take any other recreational drugs?
I tried marijuana when I was young, but it just made me hungry. I gave that up. Nothing else, no.
Okay. And have you ever tried IV drug use?
No.
No. Okay. And do you drink much?
Socially, in the weekends.
How much do you drink a week?
Well, Friday and Saturday night, probably about 5 or 6 drinks
Okay.
each night.
Each
Cocktails and wine, yeah.
Okay, sure. All right. Are there anything else you think that could be important that I've missed or you want me to know?
Just really want to get it cleared up as soon as
Sure.
possible.
Absolutely.
Being
And I
coming back.
understand. So hopefully we'll get to the bottom of this today. What I'll do is I'll examine you now, and that's just like a pap smear, and I'll take a few tests. Hopefully after that I can give you an idea of what it might be anyway, and we can start treatment for you. There are some things though that have to be notified in terms of to the government anonymously, but also to partners because they need to be treated as well. Okay, so let's get this sorted out as soon as possible. All right. Why don't you go and get dressed and pop your bottoms off for me, and I'll be a second.
Okay, thank you. Thanks.